The meanings of some of the words from the interview are given below. Find the words and fill in the crossword puzzle. 1. Psychological treatment of people using dialogue. Psychotherapy. Psychological treatment of people using dialogue. Psychotherapy. 2. Process of sorting patients. Triage. Process of sorting patients. Triage. To prepare and arrange. Deploy. To prepare and arrange. Deploy. Special department of a hospital for intensive care of patients. ICU, which means intensive care unit. 5. To include as a part. Incorporate. To include as a part. Incorporate. Identification of nature and cause of a disease. Diagnosis. Identification of nature and cause of a disease. Diagnosis. Not having sufficient service. Underserved. Not having sufficient service. Underserved. Epidemic over a wide geographical area. Pandemic. Epidemic over a wide geographical area. Pandemic. 1. Psychological treatment of people using dialogue. Psychotherapy. So psychotherapy, what is psychotherapy? Psychological treatment of people using dialogue, or you can say treatment of mental condition. Treatment of mental condition by talk therapy. Psychotherapy means talk therapy or study of mind. 2. Process of sorting patients. Triage. So triage भनेको के रहेछ? Triage is a process of sorting patients according to the urgency of their need for care. So triage भनेको चाहिँ बिरामीको चाहिँ अवस्था हेरेर उनीहरुलाई चाहिँ कस्तो खालको केयरको आवश्यक छ भनेर पत्ता लगाएर त्यो अनुसार बिरामीहरु छुट्याउनलाई नै के भनिम? ट्रियाज भनिम है. Deploy to prepare and arrange. So deploy भनेको के रहेछ? केही कुरा प्रिपेयर गर्नु, रेडी गर्नु, अरेन्ज गर्नु लाई नै के भनिम? डिप्लोय भनिम. 4. Special department of a hospital for intensive care of patients. ICU. ICU भनेको के हो? जसलाई चाहिँ इन्टेन्सिभ केयरको आवश्यक छ उनीहरुको लागि बनाइएको हस्पिटलको डिपार्टमेन्टलाई के भन्नु? ICU. Okay, next. To include as a part. केही कुरालाई इन्क्लुड गर्नु, केही कुरालाई पार्ट बनाउनु, that is called incorporate. Incorporate. Identification of nature and cause of a disease. रोगको अवस्था र कारणहरु थाहा पाउनलाई के भनिम? डायग्नोसिस. So not having sufficient service. Underserved. Underserved भनेको के रहेछ? सेवा सुविधा चाहिँ जति पाउनु पर्ने त्यति नपाएको. Epidemic over a wide geographical area. Pandemic. Say pandemic भनेको के रहेछ? Epidemic over a wide geographical area. So यिनीहरु के छ फरक? Epidemic र pandemic मा के छ फरक? Epidemic भनेको चाहिँ रोग जुन चाहिँ सीमित एरियामा फैलिन्छ. मतलब एक मान्छेदेखि अर्कोमा सर्यो त्यो के भयो? इपिडेमिक भयो है, रोग चाहिँ. अब पेन्डेमिक भनेको चाहिँ ठुलो क्षेत्रमा फैलिने क्या, एउटा रिजनदेखि अर्को. जस्तै कि कोभिड-19 के भएको थियो? एउटा क्षेत्रबाट अर्को क्षेत्रमा हुँदै हुँदै एक देशबाट अर्को देशमा गयो नि, त्यो कोभिड-19 के थियो? पेन्डेमिक थियो. एपिडेमिक भनेको चाहिँ जस्तै कि झाडा पखाला एउटा एकजनाले लाग्यो भने उ वरिपरिको कम्युनिटीमा सर्न सक्छ, बट त्यो चाहिँ का एक देशदेखि अर्को देशमा त सर्दैन नि त हो. सो दैट इज एपिडेमिक. र पेन्डेमिक भनेको चाहिँ के हो त? एपिडेमिक ओभर अ वाइड जियोग्राफिकल एरिया. Task B. Read the interview again and write whether the following statements are true or false. A. Internet service is necessary to use telehealth service. So in order to use telehealth service, internet service is needed. Is it true or false? Let's see. done through video chat. So it says telehealth is a method of providing medical care remotely, usually through video chat. Can we do video chat without internet? Give me the answer. Can we do? It allows primary care clinicians and specialists to further their reach for treating patients wherever there is an internet connection. So here also it says through video chat. Telehealth is done usually through video chat, and allows, it means telehealth allows primary care clinicians and specialists to further their reach for treating patients wherever there is an internet connection. So answer is true. Internet service is necessary to use telehealth services. B says, when health professionals like doctors, nurses or other health workers, when they provide telehealth services, they are at high risk of being infected due to the exposure to patients. Is it true or false? So के भयो यहाँ टेलिहेल्थ सर्भिस प्रोभाइड गर्दाखेरि चाहिँ हेल्थ वर्कर्सहरू चाहिँ पेसेन्ट्सको एक्सपोजरको कारणले चाहिँ उनीहरूलाई पनि पेसेन्ट्समा भएको रोग सर्ने, उनीहरू पनि डक्टर्सहरू पनि इन्फेक्टेड हुने चान्स चाहिँ धेरै छ, उनीहरूलाई चाहिँ त्यो रिस्क ज्यादा छ भन्दैछ. इज इट ट्रू अर फल्स? लेट्स डिसाइड. सो मैले मुनि पढ्दै चाहिँ कन्टिन्यू मैले रिड गर्दैछु. The benefits of telehealth for healthcare providers and patients is that these services can be faster, safer. Look, telehealth service is faster and more effective and less expensive in the long run, especially during a time like the COVID-19 pandemic, where telehealth has allowed access to medical care without going to hospitals to protect patients and hospital staff. Hospital staff mean health professionals from being exposed to the infection. It says protect hospital staff from being exposed to infection. So they are not at high risk. Because it says telehealth protects hospital staff from being exposed to the infection. So answer is false. C. Telehealth service can be the best alternative to a face-to-face service. It says best alternative to what? To a face-to-face service. It means telehealth service can replace a face-to-face service. Can it replace face-to-face service? face-to-face सेवा सुविधा जुन लिन्छ पेसेन्ट्सहरूले त्यसलाई चाहिँ के गर्ने रे यसले रिप्लेस गर्छ भन्ने चाहिँ इज इट ट्रू अर फल्स? लेट्स सी. We have read up to here. हामीले यहाँसम्म पढिसकेको छौँ. म माथिको हेर्नु है, म कन्टिन्यू गर्दैछु. So our keywords were what? हाम्रो keywords के थियो? face to face service हो या त्यसको त्यसलाई म खोज्दैछु face to face. I am searching for face to face service alternative or the synonyms of face to face service. So I'm going through the text, I'm going through the passages, and I have found here, look, face to face services. So our answer is here. This is our location. This is the location of answer. Telehealth will not replace face-to-face care services, but we will incorporate it into healthcare facilities infrastructure. So यसले के भन्नु त टेलिहेल्थले चाहिँ face-to-face सर्भिसलाई चाहिँ रिप्लेस गर्दैन है भन्दैछ. face-to-face सर्भिसलाई हटाउँदैन भन्दैछ. तर we will incorporate भनेको we will include it. हामी यो टेलिहेल्थलाई चाहिँ इन्क्लुड गर्नेछौँ भन्दैछ केमा? हेल्थ केयर फेसिलिटिजमा. सो एन्सर इज फल्स. D. The problem with the lack of medical staff will be solved to a great extent with telehealth technology. The problem with the lack of medical staff will be solved to a great extent with telehealth technology. It means telehealth technology will help to solve the problem of lack of medical staff. मेडिकल स्टाफ एकदमै कम हुने समस्यालाई चाहिँ टेलिहेल्थले के गर्नेछ, सल्भ गर्न मद्दत गर्नेछ भन्दैछ. इज इट ट्रू अर फल्स? लेट्स सी. So our keywords here are lack of medical staff. Oh, the medical staff are not enough. There are few medical staff. So this is our what? And this problem will be solved by what? By telehealth technology. Let's see. Staffing gap. So what is staffing gap? Staffing gap. Staffing gap, it means great difference or unexpected difference between the number of staff needed and the number of staff actually is available. So चाहिएको स्टाफ र एक्चुअली भएको स्टाफ मध्येको त्यो जुन ग्याप छ त्यसलाई चाहिँ के भन्नु त? स्टाफिङ ग्याप. यानी कि अब 20 जना डाक्टर चाहिएको छ, 5 जना मात्रै छ. That is what? Staffing gap. So this is our location. It says telehealth solutions. यानी कि टेलिहेल्थले के गर्छ? रिलिभ गर्छ के को प्रेसरलाई? स्टाफिङ ग्यापको प्रेसरलाई. यानी कि यसले चाहिँ रिलिभ भनेको के हो त? फ्री गर्नु हो के, बर्डनलाई चाहिँ फ्री गर्नु, यानी कि सल्भ गर्नु. So answer is true. Yes. The problem with the lack of medical staff will be solved to a great extent with telehealth technology. Answer is true. E. The success of telehealth programs depends on the infrastructure and the best use of IT tools. Look, it says many hospitals are still facing the lack of infrastructure to implement telehealth successfully. So many hospitals are facing the problem of lack of infrastructure. Oh, that is why those hospitals cannot implement telehealth successfully. It means yes, infrastructure and then IT tools are needed. Further reading. Insufficient hardware and the right technology for each specialty. Some hospitals struggle with reliable networking infrastructures like broadband, 4G or Wi-Fi. These are all infrastructure now. 4G, broadband, yes. This could limit the connectivity with facilities and provide remote care to rural areas or mobile clinicians. Having the right technology and tools and place will be crucial to successful telehealth programs. Telehealth programs लाई सक्सेसफुल बनाउनको लागि चाहिँ के आवश्यक पर्यो? राइट टेक्नोलोजी, टुल्स चाहियो अनि प्लेस भनेको इन्फ्रास्ट्रक्चर पनि चाहियो. यिनीहरु चाहिँ एकदमै इम्पोर्टेन्ट छ भन्ने छ. सो आन्सर इज ट्रू. Internet service is necessary to use telehealth services. True. While providing telehealth services, health professionals are at high risk of being infected due to the exposure of patients. False. Telehealth service can be the best alternative to a face-to-face service. False. The problem with the lack of medical staff will be solved to a great extent with telehealth technology. True. The success of telehealth programs depends on the infrastructure and the best use of tools. True. Answer the following questions. Question A. What is telehealth service? What is telehealth service? Telehealth service, they are same. So what is telehealth or what is telehealth service? It is a method of providing medical care remotely, usually through video chat. So video chat बाट चाहिँ मेडिकल केयर प्रोवाइड गर्नुलाई के भन्नु? टेलिहेल्थ सर्भिस. अब तपाईले डाइरेक्ट यो सेम लेख्दा पनि भयो, यहाँदेखि फुल स्टप सम्म लेख्दा पनि भयो, 1 मार्क आइहाल्यो. हैन अलिकति म आन्सर अलिकति एडभान्स लेख्छु भन्नुहुन्छ भने के लेख्ने? टेलिहेल्थ सर्भिस इज अ मेथड अफ प्रोवाइडिङ मेडिकल केयर रिमोटली, usually through video chat, which makes it possible to connect patients and clinicians from any location. Full stop, done. Question B. What are the advantages of using telehealth programs? Advantages, benefits, merits हो फाइदाहरु फाइदा के को फाइदा telehealth programs को यूज गरेको फाइदा so what are they let's see मैले यहाँ के हेर्दै छु कीवर्ड हाम्रो के थियो एडभान्टेज या एडभान्टेज को के हुन्छ सिनोनिम्स so हामीसँग यहाँ के छ है सिनोनिम्स बेनिफिट्स भनेको के हो एडभान्टेज अफ टेलिहेल्थ को फाइदा कसको लागि हेल्थ केयर र पेशेन्ट्स हेल्थ केयर प्रोवाइडर्स र पेशेन्ट्स भनेको जो सेवा सुविधा लिने र दिने दुई जनाको लागि फाइदा के रहेछ इज दैट these services can be faster so telehealth services are faster safer more effective less expensive so these are the the benefits advantage or merits of telehealth services. How you are going to write? Your answer goes like this. The advantages of using telehealth programs are given below. 1. Telehealth programs are faster. 2. They are safer. 3. They are more effective and they are less expensive in the long run. Especially during the time like COVID-19 pandemic. यहाँसम्म लेख्दा पनि भयो otherwise less expensive up to here यहाँसम्म लेख्दा पनि भयो अब यो मैले भने पोइन्टमा अब तपाईले अर्को तरिकाले पनि लेख्न सक्नुहुनेछ you can write like this the advantages of using telehealth programs are faster safer more effective and less expensive in the long run both are correct दुईटै जे लेख्दा पनि भयो है okay the question why according to Dr. Chang is the telehealth service growing rapidly there are two major drivers so there are two major factors for this fast growing market the first and the most recent driver for telehealth has been the global COVID-19 pandemic. So, एउटा reason, first को reason के रहेछ telehealth rapidly grow हुनुको कारण global COVID-19 pandemic. So, this is our reason 1. अब next one है the second driver अब second को कुरा गर्दैछ is the shortage of medical professionals when demand is increasing in every year. So, second में के लेख्नु पर्यो the shortage of medical professionals. According to Dr. Chang, the telehealth service is growing rapidly because of the global COVID-19 pandemic and the shortage of medical professionals. Full stop, finish. Question D. Why is the telehealth program important during a pandemic? So, telehealth program is important during a pandemic. Why? Telehealth program चाहिँ pandemic को बेला चाहिँ अत्यन्तै महत्त्वपूर्ण छ भन्दैछ why किन यी टेलिहेल्थ प्रोग्रामले चाहिँ प्रोटेक्ट गर्छ पेशेन्ट्स र हस्पिटल स्टाफलाई हो त्यो इन्फेक्सन सर्न नदिएर भन्ने क्या यसरी सो एन्सर कसरी लेख्ने अब सो तपाईहरुको एन्सर कस्तो हुन्छ टेलिहेल्थ प्रोग्राम द टेलिहेल्थ प्रोग्राम is important during a pandemic as it protects patients and hospital staff from being exposed to the infection. यति भएपछि हाम्रो 1 मार्क आइगयो एक्जाममा हो How is the telehealth program important during a pandemic? अब answer the telehealth program is important during a pandemic as it protects patients and hospital staff from being exposed to the infection. Question E. Why are the patients in remote areas not getting adequate health services? रुरल एरिया र रिमोट एरिया भन्नु के भयो त दुईटै उस्तै हो सो दिज आर आवर keywords so for people living in rural areas their medical demands are underserved means people living in rural areas are not getting enough medical services underserved they are not getting enough services so why due to insufficient resources and long distance to drive into cities for care so there are two reasons first one insufficient resource नै के छैन enough छैन sufficient छैन they are insufficient अनि बाटो लामो छ के सिटीजको हस्पिटलसम्म पुग्नको लागि चाहिँ डिस्टेन्स चाहिँ एकदमै लामो छ रे के उनीहरु ड्राइभ गरेर जाने सो दिस आर द टु थिंग्स दैट द पीपल लिभिङ इन रुरल एरियाज यानी कि पेशेन्ट्स इन रिमोट एरियाज आर नॉट गेटिङ एडिक्वेट हेल्थ सर्भिसेस दे आर अंडरसर्व्ड द पेशेन्ट्स इन रिमोट एरियाज आर not getting adequate health services अब why भनेपछि के आयो आन्सरमा because of insufficient resources and long distances to drive into cities for care full stop if mention the top 3 challenges of telehealth services telehealth service को 3 वटा टप च्यालेन्जेसहरु के हो मेन्सन गर्नुस् biggest challenges means top challenges so it says many hospitals are still facing the lack of infrastructure to implement telehealth successfully so first challenge is lack of infrastructure to implement telehealth successfully. Next, some hospitals struggle with reliable networking infrastructure like broadband, AG or Wi-Fi. अब कुनै कुनै हस्पिटलसँग चाहिँ इन्फ्रास्ट्रक्चर त छ तर रिलायबल नेटवर्किङ इन्फ्रास्ट्रक्चर छैन रिलायबल के हो here struggle means they are struggling they are not having so in the place of struggling you can write no reliable networking infrastructures like broadband 4G or Wi-Fi and third one even though this new technology is quickly being integrated there is a learning curve to using telehealth versus traditional healthcare operation हो के भन्दैछ लर्निङ कर्भ छ के हो एउटा जियोग्राफिकल रिप्रेजेन्टेसन जसमा चाहिँ टेलिहेल्थ भर्सेस ट्रेडिसनल हेल्थ केयर अपरेशन्स युजर्स फेस अब्स्टकल युजर्स के युजर्स टेलिहेल्थको युजर्स दे आर फेसिङ प्रब्लम्स अब्स्टकल्स सच एज लर्निङ टु युज डिफरेन्ट टुल्स अनलाइन स्केड्युलिङ फर भर्चुअल भिजिट्स ट्राइएज प्रोसिड्युर्स एन्ड बिलिङ पोलिसीज हो टेलिहेल्थ त छ तर टेलिहेल्थ चलाउनको लागि चाहिँ युजर्सहरुलाई खासै नलेज छैन हो डिफरेन्ट टुल्सहरु कसरी युज गर्ने त्यो नै थाहा छैन उनीहरुलाई चाहिँ टेलिहेल्थमा जानको लागि चाहिँ टुल्सहरु कसरी युज गर्ने कसरी पैसाहरु मोबाइल फोन सेल फोनबाट तिर्ने तिनीहरु नै थाहा छैन भन्दै छ के सो यो कतिवटा भयो यो थर्ड अब्स्टकल दिस इज द थर्ड बिगेस्ट च्यालेन्ज अर टप च्यालेन्ज सो फर्स्ट के भयो lack of infrastructure to implement telehealth successfully second में क्या आयो no reliable networking infrastructures like broadband 4G or Wi-Fi अनि third में क्या आयो telehealth users facing obstacles such as learning to use different tools online scheduling for virtual visits triage procedures and billing policies so these are the top 3 challenges grammar task B choose the correct answer so यहाँ option भएको यो should भयो no had better not ought to these all are modal verbs or semi modal verbs यिनीहरु चाहिँ के हो त modal verb या semi modal verbs हरु है एक मोडल भर्बको चाहिँ आफआफ्नै युज गर्ने रुल हुन्छ त्यो अनुसार हामी फिल गर्दै छौं सो ध्यान दिएर सुन्नुहोस्. I need help, doctor. My baby doesn't sleep well. What should I do? के गरौँ भनेर के माग्दैछ? सजेसन. So should is used for asking suggestion. एउटा सेमी मोडल या मोडल भर्बको चाहिँ धेरैवटा फङ्सन्स हुन्छ है. सो थोरै डिफिकल्ट टपिक हो, ध्यान दिएर सुन्ने, प्र्याक्टिस गरेपछि मात्रै यो दिमागमा सेट हुन्छ. सो सुडको के हो त काम? सुडले अब्लिगेसन इन्डिकेट गर्छ. अब्लिगेसन गर्नुपर्ने कुरा हो, लाइक यु सुड गो होम अन टाइम हो, तपाईँ घर टाइममा जानुपर्छ, लाइक दिस हो एउटा अब्लिगेसन. अर्को देखायो ड्युटी देखाउँछ. यसले के पनि देखाउँछ? एडभाइज, रेकमेन्डेसन र प्रोबाबिलिटी. तर यहाँ क्वेसन एमा चाहिँ सुडले के देखायो? सजेसन, एडभाइस माग्दैछ. के गरौँ, मेरो छोरी, मेरो बेबी मजाले सुत्दैन भनेर डक्टरलाई के गर्दैछ? सजेसन माग्दैछ, एडभाइस माग्दैछ. बी, द एरोप्लेन ओन्ली अलाउज 2 pieces of luggage. You had better not pack too much or you will have to take it out at the airport. Answer is had better not. अब यो had better not भनेको के हो त? had better not भनेको चाहिँ you shouldn't जस्तो हो, should not. तर यो had better not ले चाहिँ अलिकति स्ट्रङ वार्निङलाई चाहिँ देखाउँछ. you should not do भन्यो भने चाहिँ तपाईँले यस्तो गर्न हुँदैन भन्नु. बट you had better not भन्यो भने चाहिँ यसले चाहिँ के गर्छ? स्ट्रङ वार्निङ दिँदैछ. यदि तपाईँले यो गर्नुभयो भने चाहिँ यसको चाहिँ के हुन्छ? नेगेटिभ आउटकम, नेगेटिभ रिजल्ट आउँछ है भन्दैछ. सो had better not means it's not a good idea to do something. If you do that, there could be negative consequences. Next one, A. I think that the grade my teacher gave me on my test is wrong. I think the grade my teacher gave me on my test is wrong. B. Really? You ought to talk to her after class today. So A is saying that my teacher gave me grade and I think that grade is wrong. मलाई मेरो टिचरले दिनुभएको ग्रेड चाहिँ रङ छ जस्तो लाग्दैछ भन्दैछ. बीले के भन्नु? रियली? ओहो हो र? त्यस्तो हो भने त तिमी तिम्रो टिचरसँग चाहिँ भेटेर कुरा गर्नुपर्छ भन्दैछ. ought to भनेको के हो? must. You must talk to her after class today. ought to ले के एक्सप्रेस गरो? ought to ले ड्युटी एक्सप्रेस गर्छ, नेसेसिटी र मोरल अब्लिगेसन. यहाँनिर चाहिँ के गर्यो? ought to भनेको यु निडेड, नेसेसिटी इन्डिकेट गर्यो है. गएर तिमीले उसँग कुरा गर्नुपर्छ भन्दैछ. डी, इट्स रेनिङ and I don't want to get my dress wet. I dash an umbrella. I had better take an umbrella. यो had better भनेको के हो त? यहाँनिर had better ले के देखाइरहेछ? अर्जेन्सी देखाइरहेछ नि त हो. लुगा भिजाउन जाऊ न. सो अर्जेन्ट के छ त? अम्ब्रेला बोक्नुपर्ने अर्जेन्सी छ नि त. सो had better is a semi-modal verb. It gives advice, warning, suggestion, and it implies a strong sense of urgency or importance. So you had better take an umbrella. D. Dinesh loves chocolate, but यहाँ के आयो? कन्ट्राक्सन आयो है. दिनेशलाई चाहिँ चकलेट्स मनपर्छ तर भन्दैछ. Dash too much or he will put on weight. अब यहाँ put on weight भनेको मोटाउने छ. सो अब खाना पर्यो कि खाना परेन? You should eat or shouldn't eat? The answer is he shouldn't eat too much or he will put on weight. Shouldn't ले के गर्यो? दिनेशलाई अति धेरै चकलेट नखाना भनेर चाहिँ एडभाइस दियो या रेकमेन्ड गर्यो के. एडभाइस दिन, रेकमेन्डेसन दिन, प्रोबाबिलिटी देखाउन, अब्लिगेसन देखाउन र ड्युटी देखाउन. यहाँनिर चाहिँ के गर्यो? यसले एडभाइस दियो. धेरै अति नै धेरै चाहिँ नखाऊ भन्दैछ F. My mother isn't feeling well, so I told her that she dash to the doctor. के भन्दैया My mother isn't feeling well. मेरो मम्मी सन्चो हुनुहुन्न सन्चो फिल गर्दै हुनुहुन्न So I told her त्यही भएर मैले उलाई भने के भन्न that she ought to go to the doctor. यहाँनिर ought सँग जहिले पनि to लाग्छ यहाँ त to छैन त्यही भएर यो रङ भयो यो पनि रङ भयो So ought to ले के देखायो ड्युटी देखाउँछ नेसेसिटी देखाउँछ र मोरल अब्लिगेसन देखाउँछ अब यहाँनिर ought to चाहिँ के छ नेसेसिटी जानु पर्छ है भन्दैछ आवश्यकता देखायो So I told her that she ought to go to the doctor उ चाहिँ डाक्टरकोमा जानै पर्छ किन भन्दाखेरि she is not feeling well A. It's so hot यसले भन्यो ओहो आज कस्तो धेरै गर्मी अनि बीले भन्यो you should take off your jacket take off भनेको लुगा चाहिँ के गर्नु खोल्नु you should take off गर्मी छ नि त अब take off you should take off your jacket put on भनेको त लगाउनु गर्मी छ अनि कसैले ओहो लुगा चाहिँ धेरै लगा भन्छ नो भन्दैन you should to take off यो should सँग के आउँदैन to आउँदैन so answer you should take off your jacket H. I'm going to visit your country. म चाहिँ तिम्रो country visit गर्न जाँदैछु. Where should I go if I want to go shopping? So यो where भनेको WH question यो question word पछि के आउँछ हामीसँग auxiliary verb त should where should I go यहाँनिर I अगाडि आउँदैन यो wrong भयो ought to त चाहिँ हुँदैन